Welcome to For the Better, a podcast about the people and ideas transforming healthcare for good. I'm Lauren Miners. Join me as we explore how innovation and empathy can create a healthier future for everyone. Hello, and welcome to For the Better. I'm Lauren Miners, and today's guest has spent more than 35 years living and breathing healthcare marketing, working with everyone from community hospitals and regional health systems to academic medical centers and managed care organizations all across the country. She's the kind of person who knows how to get agencies and health systems to really work well together, which if you've spent any time at all in this industry, you know is no small feat. She currently serves on the National Advisory Board for the Society for Healthcare Strategy and Market Development. She's a frequent face at industry conferences, which is how we know each other. And she runs her own strategy consultancy called Strategy for Hire, where her official title is Chief Dot Connector, which should tell you everything you need to know. Please welcome my friend, Laila Waggoner. Hey, Laila.
Hello, Lauren. It's so good to be here doing this with you.
I'm
Super
so excited to have you. Yes. And I have to say that in this season, I have already name dropped you on at least 2 other episodes.
Uh-oh.
So by the time
I've only heard one of those.
There's another with our mutual friend Priya.
Great.
Going back to the fact that you are a tremendous dot connector, that is your title that you gave yourself, which could not be more accurate. That's just absolutely evidence towards that. So just an absolute joy to have you today.
Thanks so much. I really have been looking forward to this. I was like, when do I get to come out and talk to Lauren? And like, yes,
indeed.
I got invited.
Indeed. Well, for those of you who might not already know you, can you give us just a little bit of a tour of your background and the work that you're doing now with healthcare institutions and agencies and SHSMD and how all of those things kind of have come together beautifully in your life and career?
Well, we don't have that much time, Lauren, because it has been a very long time, as you mentioned. But, you kind of mentioned it. I have been working in and around healthcare marketing for the better part of my full career, which now is more than 40 years. And it really started at my first agency job where my very first client was a little community hospital. And from there, like you mentioned, I've worked with all sorts of different healthcare organizations, a long, long time on the agency side where I really did have the opportunity to work with really fantastic clients who trusted me and our teams at the various agencies to really work closely together. So I learned a lot from that side, but there was a whole nother level of education when I had the opportunity to join a health system as a marketing director for first 2 and then ultimately 4 of 11 market areas, 15 acute care facilities, and all the different care delivery points of care that came with that, and all of the different personalities and hospital presidents and market presidents. And that was a real lesson that filled some gaps that I didn't even know that I had at the time. I thought I kind of had seen it all and knew it all, but really being on that client side and understanding the perspectives has been just a gift. And it was a really, really great experience. And then, back and forth to other agencies. And now, as you mentioned, I have this fantastic opportunity to sort of bring all of those different points of view to my clients, whether they are health systems directly. And there I can, either help fill a gap for them or, as you mentioned, help them get better and more out of their, not more, but different, I would say, out of their agencies, thinking differently about the way they work together and how to create those connections. And then also, as you mentioned, working with agencies, or as I say, those who serve health systems. They're not necessarily just agencies, they're solutions providers of all sorts who want a better understanding of what goes on inside the health system and how maybe they're being perceived and ways to deliver greater value, right? And so that's been just a real wonderful evolution of my career. And it's a real joy day to day. I still really love what I do and have the opportunity to continue learning from all the people I work with and also hopefully to deliver value. So it's great fun.
Yeah, you are unique, I think, in that way that you have seen it from both sides, back and forth throughout your career to see how things change on either side. And I want to call out that that's kind of part of our origin story, right? Like you and I met at a conference,
It
and
is.
that's its
Yeah.
own that's its own story. But what struck me about you and why I was drawn to you was that one of the first conversations we had as we were standing in our booths, with our masks on and all of that, was that we had a conversation about that client value, about wouldn't it be better if, a web development agency could show up alongside a branding agency or a paid media agency to show the holistic value and that value in that partnership. So I just say that to tell our listeners that you're just wired in that way of like, okay, well, how can we make this just a little bit better or a little bit more interesting or as you said, like different and think
Yeah.
differently about how to create that longer term value.
Yeah. Yeah. And that's exactly, I think, where the journey has taken me is, one of my strengths I love the Clifton Strengths Finders. And one of my strengths is maximizer, right? So it's not
Oh,
thinking about just how to make something good, but it's how to take something really good and make it even better and finding those different ways of thinking about things. And, I've mentioned this in a couple of conversations that I've had since last year's SHSMD conference, where the keynote speaker talked about doing different things differently. And that just has stuck with me so much that it isn't just about doing things differently or doing different things, but doing different things differently. Because if you do different things, but you
ooh.
do them the same old way, right? Or you think about them in just your normal way of doing things, you haven't really challenged yourself and maybe opened yourself up to what's possible. And so that's part of what I think dot connecting is about is the dots are all out there, whether they're people or ideas or data points. And dot connecting is really about finding patterns and maybe looking at the same set of dots multiple ways, right? And so think about when you used to play connect the dots, right?
Tell you.
There was the prescribed way to connect the dots, but you might have also seen if I connect the dots in this way, there's a whole different picture that emerges. And so that's part of what I love getting people to do and organizations to do is to really think differently and to do different things. So I don't
Yeah,
even know if I answered your question. I just
you did.
meandered off of every last thing you said.
No, you did. You
But I
answered.
do.
Yeah, you answered the question, and the question or the prompt was like, "This is just the way that you think and you
My brain
approach.
works. Yes.
This is the way your brain works, and that's like your unique value. That's your essence." So to speak, is that you are
Yeah.
always like I feel like anytime I talk to you, even if it's just like 5 minutes in the hallway at a conference or something, like you always are like your brain is just going and you're like, well, what I just heard this and I'm wondering if we can X, Y, and Z. And then you just sort of float off into through the rest. I'm like, oh my gosh, I don't know. That would be great. So, so yes, I did want to
Stop.
highlight and celebrate that. Because it's something that is unique to you.
Oh, thanks. Yeah. I do think there are those of us out here now, and particularly I would say more and more in the last year or two, as all of the change has really swept our industry. And there's been a lot of, whether it's turnover or just shifting sands, right? So there are now more and more consultants and folks out there who bring both perspectives. And I think that that's wonderful. I just think the more we can hear each other and see each other's points of views, just the smarter we'll become and the more interesting the conversations will be. So I
Yeah.
love that. And it is something that I bring, but I don't think I'm alone in bringing it for sure. You just haven't
I
met
think
the
you're
others yet.
right.
I'll have to connect you.
No, I think you're right. I'm seeing a few. There are a few individual folks that are starting to kind of like come into the
Yeah.
market, and that has been interesting to see that not only that systems are valuing that inside outside sort of
Yeah.
perspective, because a lot of times you just don't have the muscle memory on either side of the coin to
Hmm.
develop those strategies, to think outside of your constraints, outside of we've always done it this way, outside of what your leadership is expecting, whatever the case may be. The shift in the industry to value those folks who are able to raise their hand and say, like, I understand what you're up against, and I also know what else is possible out here. And so how do we marry those things together? So,
Yeah.
you, because you are in this unique and growing position in the intersection of multiple collaborations. And I'm seeing this too, like on the systems side. I mean, I'm seeing systems that would ordinarily be competitors are starting to collaborate. So how do you, from that angle, how do you know a great partnership when you see it, or the opportunity for a good partnership? Like from an organizational level, either health systems or agencies, or some form of the two. Like what sparks your gut connecting? Like, there's some there. Yeah,
Yeah. We got to
yeah.
put these things together. Yeah. I think, so I'm going to come back to your question and just reflect for a minute on this idea that, you said even health systems are thinking a little bit differently about this, and I think it's important to sort of remember how health systems came to be. 40 years ago when I started in this business, there really weren't health systems per se. There were community hospitals. There were individual hospitals. There were maybe a few that had more than one hospital in a market, but they certainly, it wasn't typical at all, let's say, to have multiple hospitals or multiple systems in a market, right? So the growth of the concept of a system came from individual hospitals seeing an opportunity to connect with another hospital and become something bigger than just what they were by themselves, or potentially better, hopefully, than what they were by themselves. And there's been all sorts of reasons why, mergers and acquisitions have become their own thing, right? Within
Yeah.
health, health systems. But along the way, they weren't built as systems. They were built as individuals, organizations with their own structures and and this is part of why we are challenged yet today, even now, with the Frankensteining of, internal systems, certainly websites, right? That you're taking this website and they're built differently and you're trying to bring them together, but also just even operationally, we look for these operational efficiencies, but we weren't designed to work together as a system. And so we're starting now, finally, to see a system within a market consider that perhaps each individual hospital doesn't have to do everything, right? Like it's not
Yeah.
it's not practical. It's not efficient, but there's been so much territorialism and there's been so much, but we have to have everything at every hospital. And that isn't necessarily so, right? There's certain services where it's okay to drive 15 minutes across town to the other one in the system for this particular service or that particular. So the reason I bring up that perspective is that, supposedly and ideally, when two organizations come together to do something together, whether it's to merge, full blown get together and, go forward together, or to collaborate on an initiative, or if we think about population health, right, working together with social services organizations within the community and community health partnerships and others who are also all trying to do similar things. It works best. I'm finally getting around to answering your question. When the parties that are collaborating or that are working together have the same focus at the center. right? And so that works whether that's agencies collaborating on behalf of a client, right? If they put the client at the center and truly understand the client's goals, and we're all coming at it from our own points of view, but that's what our shared common purpose is, it works so much better. And the genuineness with which people are helping each other and supporting each other can be really magical. And that's true whether that's patients at the center, clients at the center, whatever it is we're trying to solve. If we can keep our focus on that to me is the sign of a partnership that should happen, because you're not just you're oriented properly, but you're willing to say, I want to make that my goal too. And so now we're working toward that same thing. It's, for sure it's not for everybody, and not all partnerships were made in heaven. That's for sure. But that's what I see as like the secret sauce, right? Or the magneticness of those connections where you bring them in the same orbit and they find each other because they're meant to work together, or they're focused on the same thing.
Yeah, such a great point about having a shared goal. Like, I'm thinking back to Chiprams last year, where the theme was, recovery from Helene, and how different partners in that region had to collaborate. And I've heard other stories similar to, during COVID. Yes, we're all systems. We're all fighting for the same, patient acquisition. But right now, we need to get people vaccinated so that we can, get the world back on track as much as possible. And, I'm seeing here in the Charleston market, we have an academic medical center. We have a really wonderful regional system. And then we have some other folks that are coming in from different directions, but they're all kind of Tetrising in ways that make sense for the community. Like, it doesn't feel or look like competition. It feels and looks like, here's how we're going to serve the greater health of the region in the ways that make sense for how we want to expand, what services we want to and should be providing. Like you said, it doesn't make a whole lot of sense for, one system to do. They can't do everything. They should focus on this one thing, because that's what people expect from them. And same thing with agencies. It's just being really clear on what you are literally bringing to the table for the full meal, right? Are you bringing the turkey, or are you bringing a casserole? And they're all equally important to creating the full deal.
Yeah, that's right. And I think it's a different way of thinking, like you said. I mean, I think I certainly grew up in the generalist, era where agencies took on whatever assignments their clients asked them to and figured it out, right? But we're at a point now where first of all, the pace of change is so rapid that to stay on top of all the things is, I think, nearly impossible, unless you're very, very large and you are making enormous investments and, you can keep all of those. But for the majority of the organizations that serve this market, they tend to have something that they're really, really good at.
Yeah.
And being okay with, that's what I'm really good at, and that's what I'm going to double down on. And that's what I'm going to share widely so that, people can benefit from it. I think it's evolving for sure. And I think it's been really fun to watch the evolution of that. But I mean, there are organizations that do things we didn't even, I sound like such an old lady, and I am an old lady, but really, we couldn't have imagined these job titles or these things that people are spending their time doing now, right? It just wasn't even a thing. And that's why it's so important to keep that open mind and to be ready to think differently and to evolve and to grow and to learn from each other. And I love that we are in an industry and surrounded by organizations that support that, right? That, like the conference organizers that bring us together and allow us to learn from each other, and all of the speakers that come from all of these different perspectives and are so generous with sharing what
Yeah.
they've learned. Like it's really a remarkable industry in that way. I do think it's relatively unique among industries. And I've worked with a lot of other industries, even though I have this depth of experience in healthcare. It's not so generous in some of the other spaces, let's just
Totally.
say. Yeah.
Oh my
Yeah.
gosh, totally. And that's, thank you for saying that because I've always sort of suspected that coming from like most of my career has been outside of the industry. And I was pleasantly shocked at
Hmm.
how giving people are and how open to collaboration folks are coming from someplace, where industry wide, everything was kept close to the best.
Yeah. Yeah.
And it's like,
That's right.
how do you advance and change and really serve the people you're trying to serve if you're cagey with folks all the time? Like you're stymieing yourself when you do that. I think
That's right.
that's personal
Yeah.
personal.
Yeah. Yeah.
So
Same.
taking that and like drilling down just a little bit, how you used a phrase found colleagues. So how has this shown up in like one-on-one relationships and collaborators? Because as a free agent, as you were, you have this freedom to kind of like really be this connective tissue and the one-on-ones and all of this. So like how
Yeah.
has that shown up for you in creating some of the partnerships that you've been able to create?
Yeah. I mean, I think that all still comes from that original concept of what does my client need? And
Right.
not even a client, right? Like what does this person who I have just met need? Whether they're compensating me for it or not, I get such joy out of recognizing, in a conversation, hey, you might really be interested, whether it's a personal connection, a professional connection, whatever it is. I just get a lot of joy out of helping to put those options in front of people, right? I mean, I had a
Yeah.
friend, we did this, I was just thinking of the friend that I introduced you to who just moved to Charleston not too long ago.
Yes.
And when she popped in my head, I was talking to you and I was like, oh my gosh, you two have a lot in common. You should meet. And then you did. And then you did have a lot in common. And it's like, that just brought me so much joy. Like
Yeah.
you might have met and not had a lot, and that would have been fine. Like it wouldn't have been a big deal, but it was great for her to get to meet somebody, in this new area where she,
Yeah.
and, there might be, I don't know if there's a professional opportunity that you might be able to connect with her, her too or not, but it was just very heartwarming to me to be able to do that. And so that's the kind of thing that I would just really enjoy. But I think it starts with listening to people and hearing, and understanding if they are looking for some sort of a, connection, and then being able to either facilitate that or make a suggestion of how they might be able to fill that need. And again,
Yeah.
it's not that I know everybody, but I know somebody who might know somebody, or I try to learn as much as I can about where those resources might be and be able to point people in those directions. That's just, I just enjoy it. So,
I think you and I are cut from the same cloth because those are my favorite emails to send, which is like, oh my gosh, you need to know this other person and please go do cool stuff together. And it doesn't
yeah,
have to have anything like the best ones are when I stand to gain nothing. So
exactly.
so connecting to people that are working on, a social impact project where I don't have a dog in the hunt. And then I find out that they've, done a podcast together, just like, yes,
Yeah.
like brings tears to my eyes. Or like, yes, now go, go, go. Like do the thing, have some impact. And,
Yeah.
that we just get to act as the connective tissue and yes.
Exactly.
It's
We
magic.
wave
It
our
really is. We wave our little wands and go on.
wave our little wands.
Well, speaking strategy. Um, speaking, you talked a little bit about conference organizers and our origin story began at SHSMD in 2021. And
It
you
did.
are involved. I know that seems so long ago. It
I
seems
know.
so long
We're going to have our
ago.
5-year anniversary soon. We should celebrate.
Will. We have
let's celebrate.
to.
We
I
will.
might have to.
We will.
I might have to bring out the 404 banner or something. I don't
It was
know. We
so
might have to
good. It
do.
was
We'll
so
have
good.
to do something. But you've been involved with SHSMD for a long time. You've held many
Yes.
positions in different committees and everything. Can you tell us a little bit more about like what you're doing right now for them and what those opportunities for collaboration, expansion, yeah, let's get into
Yeah.
it.
Yeah. So I have been involved with SHSMD for a very long time, over a long period of time. So not continuously, but, because I am so old, my first SHSMD
Is not what
conference
I
was,
meant.
in the previous millennium. So I think in 1999, maybe
Yep.
1998. I can't exactly remember, but and then on and off for, more than 20 years that I've been attending the SHSMD
Amazing.
conference. And I have to say that it's really just in the last 5 or 6 years, that I have both recognized and taken advantage of so many other opportunities to get involved with SHSMD than just attending conference. Conference is amazing, and it's a great place to connect with people and meet people and learn and, attend sessions and see exhibitors or exhibit, depending, where you are in that space. But I've just been blown away with the number of resources that I've discovered by serving on different committees, opportunities to volunteer, to get connected with people who I never otherwise might have met. And, I have served on a bunch of committees over the past several years. And this year I have the great honor and privilege of starting my service as a advisory board member at the national level. And it's been really remarkable. It's a really remarkable group. And we really do want to stay connected to the membership, to understand what members are seeking, what people who are not yet members, who might become members, are interested in, so that we can really stay super relevant for people in this industry. I think there's just a wide range of educational opportunities. The resources on the SHSMD website are tremendous. The member meetups that happen. And of course, I'm an enormous fan of the regional conferences and the regional chapters, where you really can get connected much more closely, I think, than you might have anticipated. And so this year I'm serving as a co-chair of the Executive Strategies Task Force. We're working on ways to get and keep more senior leaders engaged in SHSMD.
Amazing.
SHSMD is kind of unique in that it serves people at all stages, I would say, of their careers, ensuring that the executive level is continuing to be served through programming and other ways of just staying really close with that group. I'm also serving as a member of the Education and Editorial Advisory Board. So learning about some of those courses. For example, I'm going to audit the Marketing and Communications Planning course coming up, and just really getting a better sense of the kinds of training opportunities that are there. So it's really much more robust, I would say, than I think many people might realize. And even the online communities, right, where people can ask advice of their peers or get an opinion about a challenge that you're facing. There's just all sorts of ways to connect. And I really, really encourage people to explore that. And the value for the price paid is so, I think, remarkable. I think it's under $250 for an individual membership. And, that's worth it, I think, whether your company's paying for it or not. It's just the chance to really have access to so much information and so many people is I think, really great. So not to turn this into an ad for SHSMD, but I think we just did. But,
Well,
really,
hey, that's fine.
it's, it's genuine in terms of my excitement about what the organization is doing and the work that we're doing. And really, the staff is tremendous and works really, really hard to try to deliver as much value as they can out to the membership. So anybody has any questions about SHSMD, reach out. Or, Lauren knows all about the chapter life. Gosh knows you've been deep in it, deep in it.
Yeah. That's for sure. I do want to touch on something just like to and the quality of the education is that when when we have new team members that are coming on board that might not have as deep of healthcare experience as some of our other team, we put them through the SHSMD marketing training course.
Love it. Love that.
Because I mean, it's recorded. You don't have to wait for it to be live. You can go through it. And they found tremendous value, and we can see our folks grow like exponentially in a very short time because it is so well done.
Oh, that's awesome.
So plus one to that, to the like the standard education that SHSMD provides, and then yes, and to the regional conferences are. See, now I'm doing a commercial. But that's what I tell. So I work with two of them, and a MashMed and Chiprams, and that's what I tell everyone is it's small, but that's the greatest thing about it because you're able to connect with people and you don't get lost, and it's not like clicky and, overwhelming or anything like that. You really do make those good connections. And the folks that are working on those events, like we're doing it for free mostly. So like we really care. We really care about providing like the absolute best value that we can for everybody that shows up, whether you're an attendee on the system side or, a sponsor or a vendor. We know what everyone's trying to get out of that. And we're dedicated to creating that sort of environment. And I'll take one more step and say that there are potential cost efficiencies by joining SHSMD before you join a regional. You might get some dollars off. Anyway.
Yeah.
Act now for $9.99.
Yes. Yeah. Go SHSMD. But also like what's remarkable is not only SHSMD, right? There are multiple other organizations that are delivering incredible value. And like, how lucky are we to be in an industry where there are those multiple groups that are really focused on delivering value to all of us, right? So the Forum for Healthcare Strategists, HMPS is coming up, might be after this airs, or before this airs, let's say. HCIC is another one that just really great opportunities to get together and to learn from each other. And I feel super lucky. And I think as I grew up in the healthcare space and understood this about the healthcare marketing world, when I had opportunities to focus on other industries, I was always like, but where's the conference for the marketing folks in the building materials industry, for example? Like it doesn't exist, or the marketing folks in the engineering space, right? Like it's not this way. So we are super, super lucky. Yeah. Take advantage of it. I say, as much as you can.
100%. And I'm going to tie this back to something we were talking about just a minute ago, which is everyone's bringing something a little bit different to the table. The value that the HMPS team is creating is nuanced and different than what SHSMD is creating, is nuanced and different than what HCIC is creating. So you really do have the opportunity. I mean, go to all three because they're awesome and don't miss them, and know that you'll get a slightly different flavor from each one because they have a slightly different goal in terms of how they position their content, but they have a shared goal, which is make healthcare marketers better and give them a community, give them the support that they need. We're all doing the same thing. And when you get in the world, you can see all that like cool connective tissue. It's like these folks that we're not competing. We all have the same goal.
Yeah, that's right. Yay for shared goals.
Yay. For sure. Before I have one last question, but before we get to that, I want to just quickly ask, and I will daylight this. I'm not sure exactly when this is going to air, but I would love for you to share, where can people find Laila Waggoner on tour this year?
Oh my gosh, on tour. Well, you can always find me on LinkedIn. That's probably the easiest way. You can also find me at strategyforhire.com. But out and about, I will be. So tomorrow, April 1st and 2nd. So that's how long ago this was for you all in the future.
For listeners.
I'm headed to South Dakota We
That's
are
right.
doing something new. We're trying something a little bit new, doing a women's leadership retreat. It's kind of a small, intimate gathering, but I am putting on a kind of a strategy planning workshop. And so it's been really fun to put that work together. So that's tomorrow and the next day. Then I'll be at MashMed out in Baltimore. Then I will be I'm clicking through my other trips that are interspersed in between these. Then I'll be at Sway in Boston. And then I will be at HMPS in Salt Lake City. Super excited about that. I get to
Yes.
facilitate a panel discussion called Build versus Buy, and really exploring whether organizations are building internal capabilities versus outsourcing, and how to make those decisions and really think
Ooh.
about how to engage with the exhibitors at a conference like HMPS. Because if you're thinking ahead, you can really get great conversations where you learn what you actually need to know. So that's a little teaser for that one. And then wrapping up the spring conference season with NESHCO in Burlington, Vermont. And then in the fall, for sure, I will be at SHSMD, of course, back in Baltimore. Not sure yet about HCIC, but likely we'll see you at Triprams again. So it's a busy year for conferences this year, which I love, being out and about and connecting with people. So.
Well, you do such a wonderful job of it. I feel like every time I see you out and about, moving around, like you don't stop moving, because I
That's
think
fair.
that you know everyone in healthcare, and if you see a face you don't know, you're gonna know them. You're gonna hunt
Yeah,
them
I'll figure it
down
out.
and get to know them.
I'll find someone to
So
connect me with them. That's right. That's right.
that's right. Because you're a connector.
Yeah.
So, final question before we part ways: if there were one thing that you could do to change healthcare for the better, what might it be?
You gave me the heads up that this was going to be a question, and I've been thinking a lot about it. And, you didn't say healthcare marketing. You said changing healthcare for the better. And I've been trying to figure out a way to say this. I think if everybody could tap in, everybody, right? Whether it's a care provider, and for sure it has to be the care providers who are doing just amazing and remarkable work, but who are exhausted and who are under incredible pressure, and there's not enough of them, and all of that. But it's also everybody else surrounding them and supporting them. And for sure, anybody that either interacts directly with people who are seeking care, whether that's, directly or indirectly through the experiences that they create for those people, to just tap into your humanity and remember, I don't want everybody to have experienced a terrible health crisis, but most of us have for sure had those days where we feel terrible, or we have cared for somebody who is quite ill. And the compassion and the empathy of that moment, and recognizing that that's everybody's moment all the time, like that it doesn't. And I think actually Chris Baird, who you had on recently, says this, there's no asterisk. There's no except on my bad days, or, except when so-and-so is working and she just can't seem to find her empathy for people, right? So it's just bringing that empathy to whatever it is we're doing, and remembering that patient acquisition and, clicks and all the things that we're chasing is really about people who are facing some of the hardest things maybe in their lives, and to just keep that humanity in our work. I think that would make healthcare better no matter what. That's my thing.
I love
It's just
that.
one little thing. Could we do that?
It's just show up and be a little bit more empathetic. Just a little.
But it's
No,
hard,
that's we do. We get so wrapped up in our own stuff, and
Yeah.
if we can take, even if the work is clicks and conversion, take a step back and realizing that the person that's clicking is at best not excited about going to have their physical. Okay. Like that's at best, and then everyone else could be having one of the worst days of their life. So
Yeah.
that's,
And what a privilege it is,
empathy.
I guess just reminding ourselves too, what a privilege it is to be in this business.
Yeah. Yeah. Yeah.
And the privilege has been all mine. Thank you.
Oh, no,
This has
no,
been
no, no,
so
no,
fun.
no. Right back at you. It's a
So fun.
privilege to know you and be in your orbit. And thank you so much for hanging out with me this afternoon. It's been a long time coming, and I'm sure that we'll have another chat at some point because you have lots and lots to talk about because you have lots and lots of expertise that people need to hear. Yeah.
Oh,
Yeah.
thank you, Lauren. It's
Yeah.
been great
Thank
fun.
you. Thank you so much.
This has been For the Better. I'm your host, Lauren Miners. Production by Liesl Epps. Graphics by Liesl Epps and Danielle Sally Creative. Illustrations by Flavor Graphics. For the Better is sponsored by Reason One.